So, good evening. I'm Rosaura de Jesus. I'm a student becoming a chiropractor. I would like to be a human chiropractor, and also I would like to become an animal chiropractor in the future. Um, and I mentioned that because some of the examples that we're going to do here, we're going to be talking about our future practice, and some of them I would like to kind of connect them with given chiropractic care to animals also. So I'm going to be discussing the different assignments that we did for this quarter's capstone, which was personal marketing. And this is my first binder. And here I have all the assignments that we did throughout the different weeks with different themes, which is what we're going to discuss right now. This right here is kind of that code that you get when you submit your assignment. So the first week we talked about leadership. We said that leadership is a combination of vision and power. Vision was defined in the video by Dr. Rigman as the ability to give people an image of themselves or their organization as bigger the image they hold on their own. And I think that vision is something that you develop throughout the years by the education that you received here, becoming a chiropractor, and also education that you receive prior to this and part of your personality. And you have to be very clear about what your vision is, right? And your intention should be in that vision, and also being very clear for service, giving service to your patients. So then also we talked about power. As I said, leadership is kind of that combination of vision and power. Power was defined in the video as the currency of leaders, and I think that power sometimes is defined incorrectly by something that is kind of controlling and trying to get something to turn out in a specific way. But I also agree with the video was mentioned by Bennis that sometimes it's incorrectly defined, and that power mostly is kind of a vehicle for the intention that you have for something to become a reality. And if you have a really good, clear intention and a vision, you could use your power to then make it a reality and really give the service that you want to give to your patients and really help them with what they need to be helped. So we need to be very focused. So for example, having a focus of to give, to love out of abundance, that would be something that's really focused, and we can give a good example of what we're going to do with our vision in our practice. We have to have an intent. Also, it has to have a clinical and a philosophical component, just like our profession does. And also, we need to have everything that we need administratively for us to give the patient a very good first visit. We also need to be very clear clinically of what we do. So we remove subluxations. We remove subluxations to allow for optimum function of the different systems of the whole body. And that's something that we need to be very clear about and to explain to our patients so that they really know what we offer and really be connected to the care plan that we're going to develop for them. We're going to receive two types of patients: condition-based cares, which are the main goal is to reduce or eliminate symptoms or disease; corrective care, which is to use to enhance or recover lost function; wellness development care patients to ensure optimum development at each stage and maintain optimum function throughout a patient's lifetime. And I think that we as chiropractors should try to make our other types of patients, like condition-based care, corrective care patients, to become a wellness development care patient and be with us, for a lot of time of their lives so that they could have a very optimum development in each stage of their lives. So we also talked about that we have to have different formulas for us to really be understanding what's happening in our practice. So we need to have different formulas that really help us to how many new patients do we have and how many we have helped. Also, we need to be very clear in what we do about in our office, there's got to be three main factors that we need to have there, and those would be the philosophy of a chiropractor, of course. So that would be what we think about our profession and how we take our message and the mission of chiropractic to our patients, that they understand what we really do. Also, the patient's education, which that is going to be kind of connected to the next assignment, which was the healthcare class. In the healthcare class, I think that's a great opportunity for us to give our patients education about what we do, what we can offer, and how we are going to be doing it. And also training the staff. We are going to be the doctor giving service to these patients, but also our staff, the people who work with us, need to be prepared and also know what you do and how you define what you do so that they could explain that perfectly to your patients also. We need to be very uniform in what is said by the people that talks, the people that works with us, also what they define you and what you also say. That needs to be the same thing, and you need to take the same message for our patients to feel comfortable. So we also need to do a management by agreement, which is something that we're going to talk about later on when we do the example of the visit one. And a management by agreement is kind of when we explain the patient what we're going to be doing. We explain what it is, we explain the cost of it, and the consequences that they could have, and then we ask them if they want to proceed with this care. That's how Dr. Rickman defined it in the video for week 2. And it's kind of where you would give the option to the patient of if they want to start care, and you present the case to them and how you can help them, and then you wait for the patient to accept if they want to continue care with you. So right here we do kind of a yes consultation of an example of how I would kind of insert the management by agreement when talking to my patient on the first visit, kind of a role play kind of part. So I, as the doctor, would say, for example, "Hi, Kevin, I'm Dr. De Jesus. What brings you here today?" And Kevin would say, "I've been experiencing upper back pain during the past few weeks." And I would say, "When did it started?" And he would say, "It started last week after I finished putting up my Christmas lights." And then I would say, "Okay, Kevin, this could be an injury or just muscle pain. I'm going to need to perform a physical examination, and I'm going to need to fill out this history form. If necessary, we will need to take some x-rays. After that, I can understand better what's going on with you, make an accurate diagnosis, and develop a care plan to help you get better. Do you agree to proceed?" And then Kevin would say yes, and I would say, "Well, before we proceed, I need you to read and sign this form, which is definitely going to be the management by agreement." So now we're going to discuss kind of what we would do in a first visit with a patient. That first visit is going to have 3 main exams. Those 3 main exams are the physical exam, the chiropractic exam, which is a little bit different because we're looking for specific findings that could help us later on determine a subluxation and how we can help them with our corrective care in chiropractic. And also, the third part would be x-rays if they're necessary for this patient. We also need to include the history taken of the patient because this is really important. For example, knowing what medications the patient is using, what diagnosis he has from other doctors, what conditions he's been diagnosed with, which is very important for us to take into account when we're doing our care plan. And also we need to, if necessary, talk about the family history, talk about the social history that the patient has for us to kind of get to know what the patient does and how can we service them better. So the other thing would be motion palpation, which is definitely going to help us find different fixations in the patient's condition and then later on help them with chiropractic care. So then again, we need to be very clear about the management by agreement after before the management by agreement, we definitely need to give the patient 3 different reports, which are going to be the financial report, the clinical report, and the office policies. So all of this we need to give the patient to explain to them, and after we explain that to them is when we do the management by agreement and kind of wait if the patient wants to proceed with the care or if the patient does not, and make them fill out the form. So then we talked about the healthcare class. In the healthcare class, we did. This was very interesting for me because I also this quarter took the second part of the capstone courses, and this was for the healthcare class where we had to visit a doctor and then went to their healthcare class in their clinic, and that was really interesting, and it really helped me in this assignment number 4. So the healthcare class can be offered to new patients, right? And we could do it before or after we develop the report of findings. In the case of the doctor that I visited, he did it after, right? So it's kind of an orientation for the patient. We need to have a lot of personal motivation of ourselves and also to give to our patients. And also patient education is really important. This is the greatest opportunity to kind of give patient education in a general aspect, of course, because then when you get one-on-one time with the patient, that's where you would answer this private questions that they may have about their condition. But in a general aspect of what chiropractic does and what we could help them with and what are the benefits, that's just the perfect opportunity, which is the healthcare class. So it's kind of a 1-hour class, and approximately 13 themes should be covered. And each of these topics should just cover about 5 minutes. So it should be really fast because we want to maintain the interest of our patients. So here it says that if it's advisable to have a Q&A section. And I think that it's really, it depends on the doctor, because the doctor I went to, he did have a Q&A section, and it really benefited the purpose because a lot of people ask really general questions, and also they kind of use the opportunity to give kind of feedback and also give some stories of their progress or how they've been feeling after they have been with the doctor, because he did this class after giving the report of findings. So I think some of them had already been adjusted or had some type of care. So they were giving good examples of what their experience had been. So it really was great for the group. But sometimes some people want to ask some private questions, and I think that would be better if we do it discussing it privately with the patient on their own space and not making other people hear what's happening with them. The most common connector is kind of first explain what health is not, and we need to explain that before explaining chiropractic. Oh, if this is happening to you, then I can help you this way, so that people can make the connection really easy. So, and also it did mention the fire drill. The fire drill is kind of after the healthcare class. This is something that the doctor I visited did also. And after the healthcare class, what they did was that each patient was called to be in a room private with the doctor, where he would show them their x-rays and he would give them the reported findings. And I guess that in that moment he would also give the management by agreement, or if he hasn't had given it before. This fire drill kind of involves completing paperwork and performing examinations of new patients by the chiropractor or his staff, or also discussing some things that he already had in the report of findings, which was the case of the doctor that I visited. And on week 5, we talked about the 4 major categories of our marketing plan for our clinical practice. which is going to be internal procedures, external procedures, internal special events, and external special events. So which category does it fit in done consistently? So the new patient orientation definitely fits the category of internal procedures, which is also, we could include the healthcare class in there and our 10th visit feedback. So on our 10 visit, right, our visit number 10, what are some practice options you will give patients in your practice to use to introduce their friends to your practice? So of course, I did mention that for them to kind of refer friends and family and also get feedback and different suggestions on what we could do best, right? Because we really need to make our patients a priority. So I think that they should give suggestions. We should accept that feedback. And that way, that's the best way to get referred to friends and family. And that is something that a lot of doctors has told me that is kind of the biggest way that they get patients and family, new patients and family from their old patients. That's one of the best ways that they get patients, by referral from their already patients. Also, some of the suggestions that I gave was kind of inviting them to the healthcare class, tagging along with a patient on a visit, offering kind of a desk that it has a recorded healthcare class so that they can have an idea of what I do. Also, in this reality right now, it would be great if just follow me on Instagram or follow them or follow any other internet or social media where you give, of course, a very clear vision of what your service is. That will be really important, and I think those are the best ways for us to kind of market with the patients that we already have. So we have already covered what we would do on the first visit for a patient. We talk about different marketing strategies, and now last, we're going to be talking about the second binder. This binder right here is my research binder, and I started this quarter as part of the course, but it's really interesting. And I have different categories. The first category is vertebral subluxations, which I have one study, which is called the non-surgical reduction of lumbar hyperlordosis, forward sagittal balance, and sacral tilt to relieve low back pain by chiropractic biophysics. It's kind of a case report and it's really interesting. Wellness development care is the other category. And right here I have a study named Long-Term Gait Measurements in Daily Life, results from Berlin Aging Study number 2. The other category that I have is subluxation condition-based care. Here, this was really interesting, was a student-generated case reports, and that is where we had a lot of different feedback from different chiropractic students from different parts of the world, and I kind of related it to subluxation condition-based care. Then I have right here chiropractic spinal category. In this category, I have a study called the reduction of thoracolumbar junction kyphosis, posterior sagittal balance, and increase of lumbar lordosis and sacral inclination by chiropractic biophysics. Methods in an adolescent with back pain, and it's also a case report. And functional neurology and chiropractic, which I think it's really interesting. I have a study that is kind of an introduction to chiropractic functional neurology. It's really interesting. Parent mechanic systems and chiropractic. And the research that I have found in this category is lower back pain in golfers, a review of the literature, and bad medicine. And here I have decreasing malpractice claims by reducing preventable perinatal harm. This is one of those topics that I'm really curious about, because I've heard a lot of different people talk about how birth is so traumatic and how the system that we have doesn't make it less traumatic. And there's a lot of subluxations coming from birth alone and from different ways that the doctors bring these babies into the world. There's a lot of malpractice there that should be addressed, which affects babies in their life throughout their different stages in life. And I think this is really important category. New vitalistic system. And I have here the schism in chiropractic through the eyes of a first-year chiropractic student. Really love this research paper because I could identify with it, right? And I also have a last category, which is animal chiropractic. I haven't found much research yet, but I'll definitely keep looking for it because I'm really interested in having a lot of research about animal chiropractic and maybe in the future practice in one of this type of research. So just thank you for the opportunity of this great course, and I really enjoyed it, and I'm definitely going to apply a lot of this new knowledge into what I do as a student and later on as a doctor of chiropractic. Thank you.